Hey guys, John here. Titan Talk Tuesday officially on. So, I want to come at you guys with a lot of information this week, and we've got a lot of new activity here in Titan Medical Center land. And I want to go over some of the stuff. The new therapy of the week, which is AOD 9604. We get a lot of inquiries about that one, how it works, what's it going to do. At that point, I'll explain it to you guys. It's in a peptide, so it's pretty interesting. Plus, we'll go over some of the events, where we're going to be at here in the next couple of weeks, because Titan will be on the road. We won't be here in Tampa. We will be in like Orlando. We'll be in Miami coming up. We're going to be in a lot of different places. So Titan will definitely be on the move. And we have a lot of different people that are joining us. We got some athletes doing some big shows. So big ups to them. I can't wait. And we got some new video from some of the new athletes. Kind of their experience, their take on some of the therapies that maybe you guys can relate to. And you guys might want to know. So at that point, you guys, I will release those videos as soon as we get them out. So with no further ado, let's start Titan Talk. And if there's anything you guys want me to go over therapy-wise, I'll be more than happy to do it for you guys. So let's go over the therapy of the week. What up, Jason? How you doing? Christine, what's up? So therapy of the week is AOD 9604. So this is a peptide, and this peptide it's a really cool peptide. It works kind of like growth hormone, but in the same way, it doesn't have the negative effects that growth hormone can cause. And if you take growth hormone, sometimes it can cause sugar levels to rise, and type 2 diabetes, in a long-term result. Also, with abusing that. And at that point, you also have some other issues going along with this. So, like growth, unmodified growth. So at that point, with growth hormone, it's supposed to stimulate all the cells and grow all the cells in the body. That's what growth hormone does. But at that point, this has the positive upside without the negative downside. So it's great, and it's called like an injectable fat burner because it causes fat destruction per se. As far as getting rid of it. And it's really, really cool as far as that. It has no effect on the IGF-1 serums. That's another thing, to look for. If you're ever doing blood tests, you guys know, and you guys are very educated on it. Plus, the best thing about it, it's got a great safety profile. So it has GRAS status in the United States. So what does GRAS stand for? So it's generally regarded as safe. That's exactly what it stands for. So that's what GRAS status is. So for the safety profile, it's very safe. And that's from the FDA. You guys can look on the website what GRAS status is. Okay? So at that point, it's really good, especially with some of the people that want to just lose just a little bit more and lean up, and it's very hard for them to get to that point. It's a real good one, to lean down and stuff like that. Now, if you have a lot and stuff, as far as if you have a lot of, fat mass on you or a high body fat percentage per se, then at that point, you're really not going to have this one as a good tool. It might give a good jump start, but there might be some other options out there for you. And that's what the medical provider or doctor is going to go over with you in your consultation if you do come to Titan Medical Center, or they should be doing with you if you go somewhere else. So you guys should know exactly what the upside and the downside of any of your therapies are. Thank you. I appreciate it, Pat. I'm trying to live for summer, guys. So at that point, what up, Matthew? How you doing? Andrew, my man. Lisa, what's going on? At that point, you really want to get the best effect, and you better, different therapies can work different for different people, right? So that was a point that I was going to bring up today too. So different people react differently, or their bodies per se, to medication and foods, right? What some people might be allergic to, other people are not allergic to, and medications, vice versa. And that way, it's really, really crazy. So not everything should be cookie cutter in anything you do. You should really personalize it to your body and to what you need to get as that result. And what's the best way to get that result? For a lot of people, it's different things. I don't do any cardio, and that's really bad for me to say, right? I still can run up down the basketball court. I did it with my son, so, I still test myself in those real life scenarios because I really think it's all about real life scenarios, not running on a treadmill, right? So, it's how far you can run, how fast you can run, how long you can run, or any endurance sport. If you're jumping rope or doing the Wingate test or whatever it is. So, at that point, you want the best result. Anyway, with this, yes, you do need this in your life. That's right, Eva, for sure. So AOD 9604 is a great peptide to throw in your combination if you're looking just to lean down those little spots. It's good for competitors. It's good for a lot of different people. I mean, I've seen a lot of different athletes or just general patients take this and get some really good results. So at that point, that really makes me a believer as far as that goes. And there's a lot of studies and everything behind it, so you guys can check it out. Now, that is a great version of something that nobody else really has out there. Nobody else is really, giving you guys to in your arsenal of what can help you guys get these great results. So that's what I want to do, man. I want to help you guys out with that. It's a cutting edge therapy. It's really, really awesome. Peptide AOD 9604. All right, guys. So next weekend, we will be in Orlando at the Mid-Florida Classic. Deke Warner and us, Titan Medical Center, present this show. It's going to be awesome. We're going to be out there representing hard. Eva, the Titanette's going to be out there. We're going to have Big Drew's going to be out there. I'm going to be out there. Sharice is going to be out there. My son, I'm bringing him out there. I'm going to take him out there, maybe hit Disney afterwards or something like that with him. You got to get some family time in it too, right? So we're going to be out there representing hard. We're going to have give away a lot of giveaways as far as shirts, bags. We're going to be on site, answering questions and stuff like that. I'm going to have more staff there as well. So come out, say hi, see a great show. Deke's a great dude. Dennis Warner is a great man. So at that point, he's all positivity, and so are we at Titan Medical Center. So it was just a great marriage between us both. And we're happy to be along with him there and his other show. So the Florida State Classic, yeah, that's going to be awesome. That's coming up, I think, in August too, I think. I can't remember. We will have that in the newsletter. So if you guys have not been a part of the newsletter, you guys need to be a part of the newsletter. How do you guys become a part of the newsletter where you're at right now? So just write this down if you're watching Titan Talk. You can text Titan Medical to 22828. So all you got to do is text Titan Medical to 22828. All right, and at that point, you'll be signed up for the newsletter. It'll give you the instructions to add your email address. And when you add your email address, you will be automatically included in that newsletter. And in that newsletter, what it has a therapy of the week. It also has a breakdown of what that therapy is going to do and what it should help you do. And at that point, you will have some knowledge, right, about that therapy even before you call and talk to somebody. And then you can ask or formulate some other questions maybe that you wouldn't have. And you can be more educated yourself about what this therapy is and then make the educated decision if it should be best for you. And we can talk with the medical providers and see if it's going to be a good marriage between the both of you guys. Because everything should be looked at. I mean, your health should be number one importance. At that point, if you don't have your health, I say it all the time, you have nothing. You have nothing. You can't get out of bed to make no money. You can't get on stage to do no contest. You're not doing anything. You're not spending any time with your family or being around your loved ones. So at that point, it sucks. So I hate that. Health is one thing I think is, overlooked by a lot of people and taken for granted if you do have your health. So at that point, don't take it for granted. Live every second. Make sure you're making educated decisions with your body and what you're doing with it. That's another thing. So, in this, now these therapies that we talk about are great. They're doctor-prescribed therapies that come from U.S. licensed pharmacies. They're going to do a lot of these great things for you, but they're not the end-all, see-all, tell-all. You need to have some sort of activity. You need to have some sort of diet plan. Now, diet plan is not starving yourself. It's eating the right things and correct, right? So you want to eat the right amount of protein, the right amount of carbohydrates, all these macros and all that, right? Try to be simple about it. Just start eating clean. And what I mean clean is not just one Diet Coke a day. That's not going to be clean. Or I had, McDonald's only once today. Now, if you're eating McDonald's 3 or 4 times a day and you go back down to 1 time a day in like a week or 2, all right, so you're progressing back. Start taking it away until you get to your point. Don't drag it out. Start having a really, really aggressive schedule if you're going to do it. Make sure it's a realistic goal of what you're trying to do too. I mean, I think that's the biggest thing. Don't set unrealistic goals. So that brings me to another point that I want to bring up. I had one of my athletes in here, IFBB Pro, Jen McHenry. So at that point, she was in the house, and we were talking and just going in depth about a lot of different things. And, one thing that comes up sometimes is, we hit a broad audience, right? It's all across the United States. So at that point, we talked to a lot of people. People think differently. I think different than maybe somebody in Utah or down the street from here, and might see things a whole different way. And they might not like things that I like. So that's perfectly fine. That's your opinion and that's what you like. And God bless, and I respect that totally. But, when I get to things like, hey, John, why do you have these bodybuilder type people, representing your company? Why do you have a lot of workout videos and stuff like that? Well, first of all, our marketing's a whole different way. That's on purpose, right? The second thing is that a lot of people that are trying to get healthy or trying to be getting motivated to go to the gym might need a push in that direction. So at that point, they might gather some great motivation. I know some patients have from some of these people that are up there and representing like that. So at that point, they've been drawn in and they've really got the bug per se to get themselves healthy, to get themselves feeling better, to get themselves feeling stronger, right? And that helps in a number of different ways. A healthy body, healthy mind, that's going to be a great combination. And mental health, I mean, that's a big subject these days, right? Mental health is on the rise, and the fall of mental health, I should say, and the way that we're treating mental health these days. A lot of drugs out there, that can be causing a lot of other negative side effects. Antidepressant drugs are on the rise. And have you guys ever, and I'm 38, so, when we were 20, per se, did you hear about all these antidepressants at that point in time? Not really. You were hearing of Ritalin probably, and ADHD and ADD at that point in time. But it's just gone to a whole different level. And I think that the problem is that a lot of people or practitioners or whoever it may be are thinking about treating these symptoms or, at that point, maybe not trying to get to the root of the problem. And the root of the problem, you could be it could be a very simple thing as far as fixing hormones per se, because that can cause depression if you have deficient hormones. Some of these things like diabetes type 2, insulin resistance. There's a lot of different things that are going on right now that basically are affecting people and patients like yourselves. And at that point, there's not a good alternative. You have to go to a general practitioner and you're doing whatever medications they're prescribing to you. And at that point, it could be causing another negative side effect to you. I put Sharice as an example. She was on like so many medications since she's been 16 years old for endometriosis and all this other stuff that she had that his doctors were, diagnosing her with. And at that point, she cut a lot of it out, by herself. So, that's really, really big to look at. And I'm not saying cut your medication out. Do not do that. Okay, I'm saying that right now. Do not do that. Just look for better ways to make yourself healthier the best way possible. That's it. All right. So I want to answer some questions if we got any questions real quick. And then, there's Art.
We got tons of questions.
All right. Ton of questions. All right. So what do we got? Do we take health insurance? Asking for a friend. So Andrew, we don't take health insurance. So this is the reason why we don't take health insurance. We don't take health insurance because A, we don't produce diagnosis codes for insurance companies. 2, they don't want to cover most of the tests that we want to run on patients. It's got to have a diagnosis code attached to it as far as why they want to run those tests. And then at that point, if they're going to cover the test, A, and that means they're going to pay. And then 2, if the bill is going to be flipped back to you, and that bill can be very hefty. So the same test that we run, the full male panel that we run for $150 with the discount, right? That test, if you get cash pay, if you went into it and said, I have no insurance, I'll pay cash. What is it now? It's between $1,200 and $1,500. So at that point, you're going to save a ton of money, and it just is what it is. So we don't do any insurance for anything, and it's just because they don't want to cover some of the therapies, like vitamin amino acid injectable therapies. It's jumping through hoops for testosterone replacement therapy for a lot of them. And it just isn't worth the time. And we want to be able to treat patients without the doctors and the medical practitioners be able to be restricted on how they want the treatment of the patient, because your quality of life is worth it, and so is your time. So time's another thing. So with us, it's very simple and very easy as far as us being able to see you, you being able to contact us, medication getting to you, and at that point, you not having to take the vital time out of your day that you would spend your whole day pretty much in an office. If you have an appointment at a doctor's office, and I have to go to some other specialists too, so I know what it is. You go, you sit in there probably about 45 minutes, maybe, hopefully maybe less. I pray it's less, right? But my last time was 45 minutes. Sat there 45 minutes, went back to the waiting room. It's another 15, 20 minutes. I'll give him 15 minutes, all right? But it was probably 20. And at that point, I finally got to see the doctor, and we went over what I needed to go over, but it was pretty brief. It was probably about 10 minutes. So at that point, I know he had to get in, turn and burn, but he did answer my question. So at that point, that's all I cared about. So that was it. But with us, it'll be very simple. You'll have somebody very attentive to you. You won't be waiting long periods of time, like 45 minutes. And it's a lot simpler for us. So I hope that answers your question. John, can you customize diet plans for your patients? So Jason Lynn, it's coming. I promise you. So I haven't announced it yet, but we're going to have a system. And what it'll do is you guys will be able to put in your favorite foods that you guys like, what your macros need, and stuff like that. And what it will do is it will customize diet plans for you. That will be our Titan medical system. I'm going to open that up for some patients and stuff like that. It will also have exercise programs in there for you. I'm customizing some videos right now, so it'll be a customized app function, so you guys will be able to go on the app and do it from the app, or be able to do it online. So you guys can do it with your phone or whatever, wherever you're at. And you guys will have these recipes. So what it'll basically break down to is it'll break down to the recipes, and it'll have all the foods that you like. So you can take out the foods you don't like, or allergies, or whatever it may be. And it'll have different diet plans like keto and all that. I want to make the options open for everybody. I'm open-minded. So at that point, when you get this diet plan, it'll be like 10-minute recipes. It'll have all the food, have everything you need to lay out, and then you can make the food and stuff like that. I am looking, it would be nice to be able to service patients, but I don't have a company that is functionally across the United States that will be able to service you guys fresh food, and I really believe in that to a certain degree, and I want the food to be good. There are some good food companies out there for sure. I definitely don't doubt that at all. But I just want to make sure it's right for Titan and right for the patients and what you guys want. I don't want to do it, excuse my language, half-ass. So I definitely don't want to do that. All right. People should go take a look at Casey. Yes, Casey Trulison's formation. And here start. Yes, Casey is awesome. So Casey's a Titan Medical Center athlete, and Angela is part of the Titan family, because athletes and their family are Titan family. Patients are Titan family. So at that point, we want to make them feel like that, and they are like that. So at that point, we got a lot of love, and they're all the way up north. So I feel like they're down here though, especially Angela. She's always involved. Casey's always involved. He's got the Casey Chronicles, which is really, really cool. The Cardio Chronicles, the Casey Cardio Chronicles. Yeah, that's awesome. It's really, really cool. Yes, get your labs done. She knows what's up. All right. So what's the cost for your programs? So Stephen, there's a lot of different programs that we do. So at that point, you really got to ask me, so is it HRT? Is it the vitamin amino acid programs? Is it the ECAs? So at that point, it's to give you a general answer so I can answer for everybody. Programs with ECAs can range from like $90 and up. HRT runs between $200 and $350, just generally. And that includes everything. So if you have questions about that or what everything is, please call us and we'll go over that. Blood test, males with a discount, $150. Females, it's $225, and that's with the discount, and that's because there's more tests for the females on there. And you guys should compare apples to apples in blood tests. Make sure what you're getting, right? Because a lot of people tell me, well, I'm getting a full panel and it's only this, or they got a full panel for $150. We'll compare our test to their test and see how many tests you get. And at that point, some of the medications you're getting prescribed, you should have some different tests ran to make sure that these medications should be prescribed for you. That it's really, really crazy. So if you're getting testosterone replacement therapy like HRT with us, you're definitely going to get like a free and total on your testosterone test, not just a total or not just a free, because they go hand in hand. Why do they go hand in hand? Let me tell you why they go hand in hand. So, free and total testosterone. Free testosterone is what your body is utilizing, and it's bioavailable in the body. Total testosterone is like your reservoir. It's your total. It's how much you have built up in the reservoir of your testosterone. And the free is taking from that reservoir and utilizing it through your body. So at that point, you want to look at free and total testosterone. Why do you want to look at free and total testosterone? Who cares? We're bioavailable. All right, so this is the reason why. Because your total testosterone, and this is a LabCorp range, from 216 to 946, right? That's the range, a huge range. So at that point, if your range, let's come back at 700, right? That's a pretty good range. It's pretty decent, right? Even depending on whatever your age is, it's a pretty decent range. So you have a 700. So if you only test your total testosterone, it comes back at 700. Well, that's pretty good. So why do I have symptoms of low T then? So you have erectile issues, you might have concentration issues, body fat issues, you just can't get rid of body fat, you're holding fat deposits. That's why. It could be a hormone issue. You're having depression or having some negative symptom of low testosterone. So if you only test your total and it comes back good, well, it hasn't told you anything. So you have two options there. They're either going to treat you on that, and if they treat you and you have a 700 with testosterone, they're kind of wrecking you at that point because you have a pretty good total. There must be something else going on, right? And at that point, you want to look at the free. So what would happen is you have to go back in for a stick, even if they want to run that test. They should have ran it in the beginning because at that point you would know right away. And when you run the free testosterone, if that comes back deficient, then you know. You say, ooh, my total was great at 700, but I had a deficient free. So my body wasn't utilizing anything out that it has. So this is why. And there's things and treatments and therapies you can do just to release the free testosterone in the body. So you can utilize it and really, really make an effect, of your natural testosterone in your reservoir instead of going right on hormone replacement therapy. And, at that point, you're making a commitment per se. And it's not a lifelong commitment when you start HRT. But when you start HRT or testosterone replacement therapy, at that point you should be at a lower level or deficient. That's the reason, because you're not really going to jumpstart your testicles to begin starting to produce testosterone. It just doesn't work like that. There are some medications out there that will do it as far as stimulating LH and FSH and stuff like that. But for older gentlemen, it doesn't really help them long term. They go on it, it might work for a little bit, and then it just goes down and decreases. So at that point, their next option is usually HRT with testosterone. And at that point, when they take testosterone, they're replacing the testosterone their body does not produce. So when they obviously replace that testosterone, their levels go back up. They start feeling better. Some people still have a problem with their free testosterone. So at that point, it could be an SHBG problem. So that is another blood test that could be ran if you're having these issues. But right off the bat, the free and total, that'll tell you right away. And then if the free is deficient, you should look at SHBG or some sort of therapy that can help release that free testosterone and unbind it. So it's ready to go. All right, so I covered that. You definitely want to look at some different things too. So if you're getting prescribed growth hormone or any peptide that's going to raise growth hormone levels or IGF-1 levels, that's what growth hormone turns into in the liver, right? It turns into IGF-1, and that's what you get all the benefits from growth hormone. And at that point, when you get IGF-1, you should be testing your IGF-1 levels, and you should have some sort of baseline. And the reasoning for that is because you know where you started at. What if you had great IGF-1 levels? What if they were over range? What if they were at the higher range? At that point, you could hinder your natural growth hormone levels. You could shut down your pituitary by taking this for long-term or at heavy doses. At that point, you're going to ruin, per se, the function there, and then you're going to be stuck doing that or some sort of substitute to be able to get up there or really feeling the effects of this possibly. So that's what you really want to look at. You want to look at some of these blood tests before you go on medications to make sure that those medications are going to be right, because all medications are going to have some sort of possible side effect or a negative hinder on your body. So really look at that stuff, guys. I really preach that. Health is number one. Make sure that is priority, and make sure that you are not blindsided by these things. At least you have some sort of knowledge. The medical provider, the doctor, should be telling you these things. Not me, not some HRT consultant or whoever it is, you should definitely be talking to somebody that knows what they're talking about as far as a medical professional, and that's like a doctor, a nurse practitioner, a physician's assistant. At that point, I'll name all of them. So at that point, that's what you guys really want to do. All right. So what else we got here? Titan's the best. Thank you. Lisa's on here. So Lisa's from New York. Holy, she's the best. She's awesome. All right. So how often should you get your blood test done after being on the program? All right. So this is another good question, Matthew. Thank you for bringing this up. Matthew's awesome. So blood testing. So blood testing is key. So once you start an HRT program, now depending on the doctor, it's going to be dependent on the medication they're going to give you. Now, for us, let's say it's an HRT program for a male. So it's a testosterone replacement program. Usually going to have an estrogen blocker go along with it, right? Aromatase inhibitor. And you're also going to have ATG along with that. The reason is because you're going to want to block the aromatization of estrogen from testosterone into estrogen, It's going to aromatize from one to the other. At that point, you also want to make sure that you're covering the base with having the testicles not get any shrinkage by mimicking the LH, which is the luteinizing hormone. At that point, it's going to mimic the signal down to the testes. It's going to make sure they don't shrink. They're going to make sure that you don't have low semen production. So that can cause some tightness, and it's uncomfortable. You don't want that. So tightness of the testes is not cool. So make sure, and we want to make sure. So we want you to have hormone replacement therapy with basically all the positives with minimal side effects or none, right? And that's really what it's about. So the question to answer is how long? 3 to 6 months. Usually we do 6 months, but we check on our patients every 28 days to make sure that their therapy is going properly. Everything is going good. There's no negative side effects. They should be checking on you. There shouldn't be any automatic refills. There shouldn't be any automatic refills and sending out without talking, just charging your credit card. Well, done. Or I signed a paper in the beginning, and they're going to send me the exact same thing. Guys, things could change. Let me give you a prime example. So when a patient goes on a program and they're on that HRT program as a male, some patients are more estrogen sensitive. So even with the prescribed dosage of that aromatase inhibitor, it wasn't enough. So they start getting sensitivity in the nipples. Some things are out of whack. Water retention, maybe a little irritable, whatever it may be. Some acne. Acne is another one. That's another big, hormone imbalance red flag. So at that point, when they do is they should call us, and they will call us because we provide top-notch concierge medical service. That means we're almost open 24/7 as far as for our patients. So when you become a Type Medical Center patient, it's literally family. So at that point, you can call, you can literally text, you're going to get a hold of somebody, and then a medical professional is going to be able to answer your questions if there is one that needs to be answered. Or we're there for you for support. So at that point, there's a lot of different questions and concerns that I answer all the time. So does Cherie. So we're on it 24/7. Our patients know that are current. So when you should be looking over these things, making sure they're done. So when you're getting these things and these medications, making sure that you understand what's going on with these medications. All right. So every 3 to 6 months on blood testing, but you should check up with your practitioner every month to make sure everything's going right. If there's a problem, you can blood test in between and make sure that there wasn't a problem there, or if there is a problem, you have a blood test like prolactin levels going high or whatever it may be, and you can fix that problem. If you let these things go for long term, there can be other health issues that are associated with that, and you do not want those other health issues. Get rid of the problem. Make sure you're dialed in. Now, once you're dialed in, it's going to be every 6 months usually. Now, it's kind of scary because I've talked to patients that have transferred over from other clinics, and they've only had a blood test one time, and that was the initial time for a whole year, and the guy didn't even feel good, and he's like, I just ordered because I signed the contract and I got 6 months of stuff and I had to do it or whatever it is. That's not right. So with us, you're not going to sign contracts as far as that goes. It's month to month. We're going to be able to work with you, whatever it may be, and it's a whole different level. So guys, make sure you guys are picking a good HRT clinic if you're going to do it, right? Make sure they're knowledgeable. They're going to be there for service-wise. The therapies are top-notch. They're coming from U.S. licensed pharmacies, and you can verify that because all U.S. licensed pharmacies, you can verify it, especially controlled substances like testosterone. And another question that comes up all the time is, hey, man, can I get like Primo or like Tren or like this other clinic has Primo? I'm like, guys, you can't get that. right? It's not for human consumption. It's not legal in the United States as far as that goes. So if they're giving you that kind of stuff, it's definitely a red flag. You're not going to find that anywhere else. Call up other HRT clinics, make sure and ask them. They're going to laugh at you. I guarantee it. So at that point, just make sure you guys know what you guys are doing and what you guys are getting into, because you guys will be associated. And you guys are obviously the guys getting the side end of the stick, or the bad end of the stick, I guess. All right. What other questions? All right. What's a good appetite? What's good for fat loss to go along? HRT also with good peptide B help with atrophy. All right. So yes. All right. So Nick. So what's good? All right. So ECA Stack Plus. That is going to be a really, really good one to go with everybody usually. There are some limitations for people that have cardiac problems, right? Heart issues and stuff like that. Obviously, your health is number one. We don't want to cause any problems there. So just check with the girls. Now, ECA Stack Plus, ephedrine, caffeine, aspirin, B12, and chromium. These are awesome. So ephedrine is going to be an awesome fat burner. Caffeine is going to be great for energy. Along with that, you're going to have a little bit of aspirin in there. It's going to thin the blood out a little bit. No heart palpitations. No jitters, no craziness bouncing off the walls. You're also going to have B12 and chromium in there, which are going to help boost the metabolism, to help process fats faster, so help you get a better result. That's why we call it ECA Stack Plus. Now, the ECA has been around for a long, long time and used for long, long periods of time as well with a lot of people. So at that point, we know it works. We know it's very, very efficient. Now, adding the B12 and the chromium on there are just going to add an extra bang for you as far as that and getting a result, and obviously helping you get there to where you want to be weight loss wise. All right, yeah, great. That's the other one. What up, Tanisha May? How you doing? So Tanisha, she loves the ECA, so she understands, and most of the people do. And if you're taking pre-workouts and stuff like that, there's a lot of stuff in there that's bad for you guys, or could be bad, and a lot of fillers and stuff like that. And it might not make you feel the best too. You might get the rush, but you either got irritable syndrome, right? You're going to the bathroom. You're feeling some type of way, or feeling sick, or kind of nauseous, just not feeling right. The ECA Stack Plus is going to be a very, very clean effect, very clean energy, concentration, along with the fat burning effect, and helping you. It will give you actually more of a boost in the gym if you're using that for any exercise or for any activity, even for long days. So it is my go-to. No energy drinks, no pre-workouts. Nothing like that. I don't even drink no protein. I mean, I might drink some protein shakes, or the pre-mixed ones, but no powders at all. And even the pre-mixed ones, I mean, that's if it's a dire need and I don't have food around. I'm definitely going to try to get some protein in, because it's hard to eat, man. I mean, you get so busy in your day sometimes, and I don't know if you guys are like this, but I'm definitely like this. And I like to eat, but I get so busy and I'm just laser focused. And at that point in time, like, the hours go by and spin, and just they go by quick. And you don't eat, and you're like realizing, man, I didn't eat nothing today, or maybe I only ate once today. I'm gonna lose muscle and shrink. That's what those guys think, right? So we don't want that, So we got to get our food in. So for me, it's a big, big thing. Which leads me along to your branched chain amino acids. That's another one. Branched chain amino acids. A lot of people are taking powders, drinking jugs all day, not feeling right, bloated. Now think about all the stuff you're having to adjust with water or liquids and stuff like that. Your stomach's I was talking about it with Drew today. And at that point, when you feel like that, it's just garbage, right? And how much are you really getting out of it? So at that point, even if you're ingesting it, you might be getting maybe 20%, 10%, 15%, somewhere in there. And I'm being gracious with the 20%. But at that point, when you're getting that, you're not really getting a great full effect from that. So the injectable version with the branched chain amino acids, and we have this in a couple of our different therapies, like our Titan Strong or our Titan Complete. And at that point, you're getting injectable branched chain amino acids. So at that point, there's only 3 of them: leucine, isoleucine, and valine. And when you're getting these injectable, you're getting almost the best version. The only better version than this intramuscular would be an IV, and that's really not for everyday use. Unless you have really a nurse on staff or a medical assistant as a wife or something like that, they can hook you up and you can get this prescribed with IVs. I mean, that's really where it's at. And it's still going to be a little bit more expensive for you to do it like that. So this is really the best way to do it, I think. In a lot of different ways for you. You can do it in your, the convenience of your own home or office. You're controlling, how much you're injecting at that point in time. You're not having to go in. You're efficiently doing it. And at that point, you're getting faster transportation, higher absorbency, which creates better results, or it should create better results, right? All right, crazy energy for sure. Yeah, I threw my scale. My percentage body fat is going down. That's all I'm at. That's what I'm talking about. Body fat going down. So that's really what it's about, guys. So for me, it's all about quality, and not quantity. So at that point, you really want to be your best. And I hear these people going on like, I'm going on bulking season. Like, all right, so what's bulking season? Bulking season is like getting big, right? So what are you getting big? Are you just gaining a whole bunch of fat? Which I understand, if you're growing tissue and stuff like that, you're having to do this to a certain extent. You got to get more calories in, but are you getting efficient calories? Are you eating clean? Are you getting the most efficient ways to get that bulk per se? And for me, I don't really say bulk or cutting phase. You should be getting lean mass all the time. So that should be the goal. Lean mass, whatever it is, and going up in lean mass and going down in body fat percentage and getting to a certain level, which is sustainable. That's a big thing that I see with competitors. They get to a certain point, they see themselves, and they were just, that day of that contest, right when they got on stage, were just like super shredded and probably, this far from death. At that point, that's not sustainable every day. So you want to make sure that you can get sustainable results and get that long-lasting physique, right? Or health. I mean, health's number one. Stat gets me through each shift. So yeah, so Pat's a state trooper out there. He's a big Titan advocate, my brother, and he's on his shifts, and his ECA is getting through his shifts. And God bless him, man. He's out on the streets, and he's got to deal with some not so good people out there. So God bless you, man, and be safe out there. Hope the ECAs are keeping you on your toes, man, for sure. All right, what's good to eat for someone that works overnight? All right, so your diet shouldn't change. So even if you work overnight, so are you asking me what you should bring there? Now, this was another thing that I've been working with. It's a Hot Logic box. I think it's hotlogic.com. So what I've been doing is I bring my meals and you can plug it in. So it has like a card after too. So if you're worried about heating your meals on the road, you can do that, and it heats it to 200 degrees. It doesn't burn anything or anything like that. It'll get it to the heat where it needs to be, and you can eat it. So I did it with steaks. I did it with some chicken, that were already cooked and stuff like that. Just threw them in there with some potatoes or white rice or whatever it may be. Now, if you're asking me diet, now I'm not a dietitian or nutritionist. Now, if you're asking me what I would think, what I would eat or something like that, or what works for me and what works, for a lot of different people that I know, the first thing I would say is eat clean. And when I said eat clean, I brought up eating clean. And eating clean involves like very lean chicken. I'm not talking about fried chicken. I'm talking about like grilled lean chicken. You're talking about very lean steak. Filet if you can afford it. If not, New York strip, or there's different steaks out there. You can just cut it out if there is. You have to get a fattier steak. Cut out the fat. Just get the lean parts of it. Cook it up and eat that down. White rice is a big one for me. Some people are advocates of brown rice. They say it's better as far as all the other things that are attached to it. I'm just a white rice guy, okay? So at that point, very plain, very simple. So white rice is for me, or a roasted potato, very good. Green beans for me, that's the only greens that I eat. I know like my son and all that, they eat asparagus, and all these different things, which is great. I never tell my son like, ugh, or like I wouldn't eat that. No, I'm like, man, I'm like, good. Eat the asparagus, or eat that good food, because I'm trying to train him young. I think the younger you train them, the more in the routine it is, and the more it's like this is everyday life, right? Because when you grow up in that routine, that's all you know, and when that's all you know, that's like that's it. So that's bond. That's what I'm gonna do. It's without thinking about it. So if you can train your kids young to look at labels, right, to be conscious of what they're eating, I think we'll have a better generation than what's coming. I fear for my son's generation and what's coming, because I mean, it's bad, man. Obesity's on the rise, diabetes on the rise, health problems on the rise. It's crazy. So I hope that answered your question, Hulk Smash. Let me know. If not, I will definitely know. Yes, we got your 6. I appreciate you guys. You guys are awesome. All right. So any other questions? I think we covered a lot today. I kind of went into some rants and some raves, and I hope you guys enjoyed. So we've got a ton of events coming up. Get to the newsletter if you guys haven't got there. I want you guys to go look at the events. We'll be in Orlando next weekend for the Mid-Florida Classic. July we'll be in Miami for the PCA. Like I said, we'll be back in August in Florida State. We've got a lot of different things, and we're going to be adding events to you guys very soon. So we will see you guys very, very soon. I hope you guys have enjoyed Titan Talk. Please, if you guys Keep it locked to Instagram, Facebook. Share these if you're on Facebook, Instagram. Please tag some friends, okay? And YouTube, press subscribe. All right. I'm John from Titan. You can call or text 727-389-3220 for any information or if you want to be a patient. Or you can check out www.titanmedicalcenter.com. I'm John from Titan. I appreciate you guys. Thank you.